edition. 54th edition of Thursday Musings. We have a most prolific speaker today. I think it is not his first talk today, sir. It must be, Dr. Avinash, must be your second or third or fourth talk today, because he can speak on various occasions on the same day. So welcome, Dr. Avinash, and the chairpersons, Dr. Amlan and Dr. Simi. Next slide, please.
Hi, everyone.
The chairman of this program is Professor Dr. Tofan Pati. He is from Cuttack. And sir, may we skip yours and ours introduction and go straight to chairpersons and the speaker. Sir, over to you.
Okay, thank you, Alim, for saving time. So I have to mention that we have got two vibrant moderators with us, Dr. Alim Siddiqui and Dr. Amrit Patijoshi. And now Dr. Simi Baraj, our chairperson, glamorous chairperson today. She did her MBBS and MD from Government Medical College Patiala and senior residency from GMCH, Chandigarh. He worked in GME Sector 32 from 2001 to 4. He worked in Toowoomba West Hospital, Australia for a year, and after that has been a consultant psychiatrist in Fortis Mohali since 2005. Long time in the hospital. Her interests are adolescent psychiatry and women mental health, along with drug abuse prevention in youngsters. She believes in primary prevention and building community awareness and participation in mental health care. She writes regular articles in newspapers and magazines to increase awareness of psychiatric disorders. She is fond of writing, reading, traveling, and bird watching. And Simi Baraj is her name in the papers. And we have got with us our other chairperson, our Dr. Amlan Kushum Jana. He is quite, you can look at him, the handsome young psychiatrist from Kolkata. He is MD, DPM and MRC Psy. He is associate professor in KPC Medical College and Hospital, Kolkata. His research area and interest includes schizophrenia and psychosomatic disorders. Welcome, Dr. Amlan, and welcome, Dr. Simi. And with this, I hand over the meeting to both the chairpersons. Now it is your time.
Thank you so much, Dr. Tofan Pati and Alim and Amrit for having both of us here. And I'd like to take this moment to welcome the speaker, the very, very eminent psychiatrist from Mumbai, Dr. Avinash D'Souza, who's very well known, and he's the founder, trustee of D'Souza Foundation, and also consultant psychiatrist, Reliance HN Hospital in Mumbai. And of course, as Dr. Alim said, he's a prolific speaker. He's involved in many, many activities. And he's also written many, many research papers and is very well known. So we all look forward to hearing him and on this very, very interesting topic, romantic love, breakup, is a very interesting topic. And as we all have seen many times, people can, wallow in that loss or rejection, often for months. And sometimes we've seen people come to us who've been in it even for years. And the neurobiology behind it is also interesting. How we help them out of it also is interesting. Sometimes it could be medication which works remarkably within 1 month in a person who may have been going through so much turmoil for months together. And I think all of us must have seen that. And sometimes it may be working on them on a more regular basis with psychotherapy or whatever. So romantic love is a very interesting thing, how dopamine and oxytocin increase when people are in romantic love. And one of the premises is that maybe their withdrawal when a loss happens leads to a addiction or withdrawal like state. So I would like to invite my co-speaker to please give his comments, and then invite my co-chairperson, and then to invite the speaker.
Yeah, thank you, ma'am. This is a very interesting topic, not to mention interesting in many ways. You've seen what happens in this sort of stress. I mean, on a lighter note, we think that it's a sort of setback, which one has to forget and move on and get along with life. But we all know it's easier said than done. We've seen in movies what happens, we've seen in novels what happens, but we also have experienced what sort of disaster it can bring, not to mention suicide. As Madam said already, it can lead to a spiraling problem of addiction, sometimes crime, sometimes other faulty coping mechanisms, leading to many problems, which keeps on increasing, making the life and the problem even more complex. So I'm happy this topic has been chosen. I'm also happy because Dr. D'Souza is going to speak about it. And I really feel that this is a topic where everyone will feel that they can participate, ask questions, and get the discussions go on. So over to you, Dr. D'Souza. Let's have.
Yes. Well, thank you very much. I'll just share my screen and start. Is it visible? Yes, on clear. Yes.
Yeah.
Okay, thanks. Well, when I was called in today evening and told to speak here, I was categorically told that the focus has to be more clinical and more therapeutic. And we're not, and I decided, yes, that's what I'm going to keep it. And post-romantic loss in young adults is something that working as a child, adolescent, young adult psychiatrist that I do, we see a lot of it in our practice. I think all of us see a lot of it. Very often, sadly, they come to us after the affair, after the break off. They don't come to us during the affair for advice. And very often the issue is that we are, they very often come distraught, upset, angry, violent, based on whatever their reactions may be. And they come hesitant to see a psychiatrist because they don't think it's a psychiatric problem. But nevertheless, they are forced, cajoled, coerced, requested, suggested by people, and then they come to us. The main issue is, how do we manage the breakdown? How do we manage the stress? And that's something which is very, very difficult, and it's confusing. It's very, very confusing, because very often you can't just tell the person, don't worry, get over it, you'll be fine, and this is a phase, it'll go. These are the very things we don't want to tell our patients, and these are the very things we are taught not to tell our patients. But we deep down know it's a phase, and we know it's something that they can get over, while there is a percentage of people who probably may not be able to get over this post-romantic loss. There are different types of post-romantic loss, which I will discuss. I will also discuss things that we see. I start with this very interesting quote that true love is the only heart disease that is best left to run on, the only affection of the heart for which there is no help and none is desired. The reason being here is that I think as a psychiatrist, something that has always struck me is, we very often, being human, have in our minds this whole facet that there are ideal couples, and there are couples who look good, and there are couples who, do not look to be together, but yet are together. And one thing which strikes me about the younger generation very often is the diversity amongst couples. And when I talk about the diversity, you'll very often see the boy and the girl who look so different. I'm not talking about whether they're good looking or bad looking, but they look so different. They're from diverse backgrounds. Their thinking is so diverse. One, for that matter, may be an engineering student. The other may be a musician. One might, for that matter, be in the field of computers, and the other one may be a dancer. So there is this huge diversity in couples which we see now. And definitely love and relationships have always occurred. But I think what has happened is that there's this spate of romantic losses that we have seen during COVID. What used to happen was a large number of college students used to have their affairs very secretly, discreetly, without parents knowing during college hours, either before college, after college, saying that there are classes, tuitions, etc., and they would meet. And what COVID did was it just stopped them from meeting each other. It just stopped them from leaving the house. It just stopped them from, being able to communicate. And they no one at home knew about their affairs, so they weren't even able to probably speak on a video call, and that led to a lot of distraught and anguish. And they couldn't even leave the house because they were told it's a lockdown, you can't go anywhere. And this resulted in probably either a lot of anxiety, anguish amongst both members of the couple. It also led to a natural withering of, you know, many relationships. Just like the autumn leaves were shed, many relationships got shed, and they led to a natural death in many relationships. People found solace with others probably close to their homes, and new relationships blossomed while the old ones died, and there was a lot of romantic loss that happened. Well, it's working as a school psychiatrist, we see romantic loss as early as 12, 13, 14, 15, and of course in the young adults. I always say it's the paradox of human nature that what is allowed at one age is not allowed at another age. So if you see children in the KG and nursery class in the picture like we are today, parents are very happy to go and click a photo of them. But the same children, if they are in the 11th standard and sitting the way they are, I mean, parents get petrified, worried, and think that, no, this is not right. I always say that a KG class boy giving a rose to the girl, everyone says how sweet, and you know, they kiss the boy, and but a 9th standard boy or a college boy giving a rose to a girl is looked at very differently. So what is allowed developmentally at one age is not there. And we are all humans. We are basically born to love. It's something that is going to happen, but it's the very basic thing. One of the main reasons why romantic loss happens is because as parents, we keep telling children love is bad. This is not the time for you to be in love. This is the time for you to focus on your academics. This is the time for you to focus on your career. So when the romantic loss happens, there is this huge truckload of guilt which is spilt on them. And, you know, they are told that, you know, you have sinned, you've done wrong, you've actually made the family name go down the drain, you've done all sorts of things, and that very often leads to a huge amount of guilt amongst the young adult. It also, another issue that does come up is that in schools, in colleges, young adults are not taught how to handle love. They're very often told to run away from it. They're very often told not to fall in it, but they're not taught about how to handle relationships. And something which I remember in a college group, when I spoke about handling breakups, they said no one has ever spoke about handling breakups. Everyone has told us about love and relationships in general. So handling breakups is never taught. I always remember as a counselor, I had an 18-year-old boy who met me and told me that I like a particular girl in my class, doctor. Do I give her a card professing my love on Valentine's Day? Should I do it? Should I not do it? What is your answer? And as a psychiatrist, I was supposed to answer him. And I told him, you're together with somebody, you may like someone, you may have feelings for someone. It may not always happen that you might get the reciprocation that you want. But please do not let those feelings die down. The other person should know about it. It can happen that she may give you the age-old statement that, yes, we can still be good friends and I have no feelings for you. Be ready to accept that. It could happen that she also has feelings but was never really eager to probably speak about it till you went and spoke about it. Either way, be ready to accept what reality is. It is this acceptance, learning to accept no from an early age, is what is not taught to children. We are very often telling children, giving them everything. So they are never taught to accept negativity. So therefore, even when a romantic loss happens, a young adult particularly finds it very difficult to deal with that kind of loss. And love can often be, this is what people who come to me with romantic breakups often say, that love can be the happiest thing ever, but it can also cause the most pain. And yet everyone keeps searching for it. Now, one of the key premises, which I believe when it comes to handling romantic loss, and something which I emphasize always as a psychiatrist, is I tell people never to give up on love. I always tell them that, you know, just because you've had one bad experience, two bad experiences, or three bad experiences, it doesn't mean that you probably will have a fourth bad experience. There is always a chance that you will find love, and you will find love in the way you want it. So the long-term cure for overcoming post-romantic loss definitely would be probably to find something, somebody, some relationship that you love, wherein love gets substituted, love gets replaced with love. But nevertheless, not giving up on love is something which I always emphasize on. There is no pill for love, sadly. And very often people come to us, and many of the people who come to us think that, you know, a few medications could probably help the person overcome the romantic loss. What I always tell people is the medication that we may prescribe, if I prescribe an anti-anxiety drug like clonazepam because there are panic attacks, or if I may prescribe an antidepressant because the person is depressed, is only to support the person. It's not being given as a cure for the romantic loss. It's not being given for in any means by which the person can forget about what has happened. No. And so there is no pill for this condition. I very often emphasize and I tell the parents there is no pill for this condition. I also get a group of people who come to me primarily because they are shocked by the fact that they have been broken off. And this is the kind of shock that they probably undergo, that, you know, why me? What was it in me that I wasn't probably so good looking? What was it in me that I probably wasn't up to it? What was it in me that made the other person reject me? And that is a question that worries them. A key question that worries them is, everything was going so fine in that relationship, and why all of a sudden this breakup had to happen? Now, why I'm mentioning this is because you'll very often find in a lot of romantic relationships, there may not be an argument for a breakup to happen. The other person or the partner may find someone else and get into another relationship simultaneously. Something as psychiatrists that we all have seen and we know and we probably agree with is that there are many young adults who are involved in multiple relationships, and they want to probably choose, you know, which relationships, which works better, which doesn't work better. So they probably get involved with multiple people and start eliminating. And when they start eliminating, then they go with the best possible choice available to them. And that's how they might, a single young adult may sometimes cause up to 2 or 3 romantic losses. And very often, as they say that many more women, people from the female gender, suffer the negative consequences of a loss. I disagree. I think men and women undergo it both equally. It's just that the men don't show it. It's very easy for the men to go into another relationship very fast, and that doesn't happen very often for, you know, women, because they've invested a lot more in the relationship. Why are we talking about loss? And one of the reasons why we're talking about loss is because it's very often one of the greatest painful things to face, which is rejection. We all know of psychodynamics. Right from an early age, parental rejection is something we dread. Rejection by our teachers in school is something we dread. Rejection by our peers is something we dread. Rejection by people who we love is something we dread. And rejection by someone who we loved the most is something that we dread the most. And that is why a romantic breakup is something which is the most dreaded agony. And very often, people want the pain to go away and cope in different ways. It's a very interesting thing to think, why is it that if I look at 10 young adults who've undergone post-romantic loss, one gets violent and aggressive, one gets sad and depressed, one gets anxious and panicky, the other one probably goes, finds someone else and starts having an affair and recovers very well. You have one more who probably throws himself into his work, into his academics, and tries to forget the affair. You have one that takes to substance use probably as a recourse. And you have one that actually breaks down into maybe even a psychotic phenomenon at times and comes to us. The whole issue is, why do these people react differently? And I believe they react differently because of the family support that they have, the kind of peer pressure they live in, the kind of defense mechanisms they've always used. So based on what they've always believed in and used, and very importantly, what is their psychodynamic combined with genetic, combined with neurobiological predisposition to these things. So if the predisposition is to anxiety, they're going to be anxious. If it is to depression, they're going to be depressed. If it is to anger and aggression, they're going to be aggressive. If there is some factor that can cause psychosis, it's going to be psychosis. If there is substance use as a coping, then it's going to be substance use. So there's going to be something or the other that they cope with. The most important thing to overcome in romantic loss is the memories. I have time and again have had people who've come to me and said, sir, we agree with everything that you tell us, that we accept the loss. We accept that, this relationship wasn't meant to be. We accept, we forgive him. But how do I forget the memories? I keep thinking of that person every day. I keep thinking of that person every minute. I keep thinking of that person from time and again. And it's very, very difficult for me to forget the memories. The most important thing to forget the memories is to make new memories. And I always say our brain is a very plastic organ. It can remold itself, reshape itself based on how we want to shape it. Are you having things around you that keep reminding you of those memories? If yes, get rid of them. Are you having things on your phone? Are you having things on your laptop? Are you having things all around you that keep rekindling those memories? Well, get rid of them. And it's only when you rekindle, you revamp, you sort of get rid of all the other memories that may be there. Probably would you be able to sort of get rid of these memories. Again, I always tell people, no memories can be totally got rid of. We've got to be accepting of the fact that certain memories will remain. We have to learn from them and move ahead. I always believe that every human being receives 10 good slaps in his life. They may not be physical slaps. They may be having been cheated by a friend, a breakup in a romantic relationship. They may be, for that matter, being cheated by a friend in a job interview. It could probably be some elder in the family having said something bad to him. There could be some issues with his parents. These all happen in everyone's lives, and these are very normal things that happen. The key thing is these teach us. They make us wiser. And they make us realize that, yes, life isn't all a bed of roses. There are going to be ups and downs. So we learn from the memories. I always encourage them. I said, there's no harm in you having loved, but you learn from the memories that taught you. Coming to this is more of my clinical classification, and I don't say that everyone might agree with this, but these are the different kinds of post-romantic losses that you may see. The one is the first romantic loss. The pehla pyar wala loss, as I call it, So very often this is seen between the age of 15 and 20. Nowadays, you see it even as early as 13. So the first rejection. The first time my heart beated for someone and that person rejected me. So they begin to feel that all men are bad, all girls are bad, all boys are bad, love is hopeless, So it is very important at this stage that they have to be counseled. Because we have to make them realize कि कोई बात नहीं दर्द मिला तो there is always going to be happiness ahead, and we have to teach them the famous song कि वो नहीं तो कोई और सही, कोई और नहीं तो कोई और सही. You're always going to get people. You can't give up on love. Why this is important is because I'll tell you this from a psychiatry point of view. I always say negotiating this first romantic loss in a young adult between the age, and I always say that there's no difference usually between a 16-year-old and an 18-year-old. So a young adult between 16 and 20 needs to be taught how to negotiate this first romantic loss, because this may prevent psychopathology in the long run. If we counsel him very well in the first 1 month post this romantic loss, we can make him strong for a lifetime. And we can make him strong for future romantic losses as well. So the first romantic loss is something which is very important. Then you have someone who I call the multiple romantic loser. They very often come to you and say that I think love is never meant for me. These are people who come to you either depressed, anxious, aggressive, anguished, and they very often have been rejected multiple times or faced breakups multiple times. I use the word rejection and breakups synonymously, so please read the two words together. They face number of breakups, and they say none of my relationships lasted. I had one relationship that lasted 1.5 years, and then every 6 months, every 8 months, I've had multiple relationships which break up. Now, very often we then need to negotiate why this is happening. You need to find out why is there an issue. The first thought a psychiatrist gets in these cases is, could there be a personality disorder component which is leading to this? But it may not always be that. It might just be the fact that this person doesn't know how to handle relationships. Either he's being too cold or he's smothering the other person with his love. It could also happen, yes, there could be that personality component that you want to look at. Probably, yes, he has not seen relationships well in his life, and therefore he probably doesn't know how to handle these relationships. The third is what I refer to as the Devadas syndrome. These are people who probably lose out on love and then later take to weed, cocaine, alcohol, substances to cope with their problems, and they are brought to us more with acute substance use to treat. But the key crux is managing the romantic loss. You manage the romantic loss, and very often they might overcome the substance. And I very often ask them that, why do you take cocaine? Why do you take cannabis? Why do you take? And they say, we do it so that we have fond memories and it helps us forget these bad memories. I've had many young Christian youth who say that I drink to drown my problems, and I tell them that their problems are very good swimmers. So drowning them is not going to help. And very often, this is also another form of the issue that we see. You see a third type of post-romantic loss, which I refer to as the Badle Ki Aankh syndrome. The Badle Ki Aankh syndrome is a syndrome where the person says, he or she rejected me, now I will show that person. How will they show that person? A, they will malign that person probably socially and on social media. WhatsApp DPs and Facebook profile pictures are changed so that the other person may feel guilt, or they try to induce guilt in that other person. It can also happen that they target his friends, or they start stalking this person and they try to see what's happening in the person's life who said no to them or who broke off from them. It can also happen that they might also sometimes have some photographs with the past boyfriend or girlfriend, and they may try and send it to the new boyfriend and girlfriend and cause problems in the relationship. So this kind of a coping with their romantic loss is also which is seen. We have something which I refer to as the Parivar syndrome. The entire family gets into the fray. This becomes quite difficult for the psychiatrist to handle, because you will have the boy come to you or the girl come to you who's undergone the loss. You have the entire family that comes to you. And that is coupled with sometimes the girl's family or the boy's family, the opposite party, and their entire family also coming and, trying to find out what's what. And this very often leads to, becomes more like a family feud versus probably a post-romantic loss. So this becomes a very difficult scenario to handle. A very important feature of post-romantic loss is people who say everything is okay, but I feel cheated. And that feeling of being cheated is something that I can't overcome. Why did the breakup happen? The breakup happened because one partner was caught cheating on the other partner. And the partner who was cheated, who was sincere, feels extremely hurt and says that I can't accept the fact that I was cheated. It pricks me in my heart that this person cheated me. And I'm not able to sort of accept this fact at all. You have another version of post-romantic loss, which I call the gave it all syndrome. They believe they gave everything they had emotionally to the relationship. And now they have no emotions at all. So even post the romantic loss and the breakup, they neither cry, they are neither anxious, they're neither upset. They go into a state of numbness. And they may be prone to break down into a psychotic episode. But more importantly, they believe that we gave everything we had to this relationship and we have nothing else to give. And this is a group which also may be suicidal at times. And you have to be a little careful while you manage this group. You have a very important post-breakup group, which is referred to as a sexual trauma syndrome. This very often comes from people who've been sexually involved in the relationship. And they very often feel cheated far more because of their physical involvement. In all of the above types, there may be physical involvement also, but there are some people who give a lot of emphasis to the physical involvement because they believed that they gave themselves fully to the other person, and yet the breakup happened. And nowadays, what we are seeing is what I refer to the online romantic loss syndrome. Up to around 12 years ago, or probably 14 years ago, when anyone told you that they had a boyfriend or a girlfriend, you would understand. Today, when anyone asks you whether they have a boyfriend or a girlfriend, I have to ask them whether it's online or offline. And the reason is there are people who have solely online relationships, and the online relationship can break off. They have never met the person physically at all. Yet they've been in love, yet they've been in the relationship. And the loss and the romantic breakup also happens online. So there's no physical meeting, and yet the breakup happens. The only thing they come for physically is therapy. Whereas the loss has happened online, it's happened virtually. So this is, according to me, the different types of romantic losses and breakups that you see. Though, of course, there may be more, and others would, of course, have more to add. What do we aim to manage in post-romantic loss? Very importantly, what we aim to manage is the individual from breaking down. That's the first thing. Further, 2, we have to teach the individual that love is not a bad thing. It's perfectly okay to fall in love. It's perfectly okay to probably, lose out on a relationship. A breakup can happen. I always tell them every adult undergoes 1 or 2 breakups before they find the person who they love. It's very normal. But we have to teach them that that's normal. Many people don't know that. It's also very important that we teach them love is normal. Breakups are normal. Falling in love again is normal. Moving on is normal. What form of counseling works? We really don't know. Sometimes just being supportive works. Sometimes what I call being imperative and ordering them and telling them what to do works. Sometimes you may have to only listen, and that may be a cure. Sometimes you may have to talk more, and that may be a cure. Sometimes you may have to advise them as you would probably advise a younger member of your family, and that works. You may not always be able to look at them as patients because they really don't come to you as patients. They may not really have any other underlying psychiatric problem. A common question asked to me by one of my resident doctors was, why do we bother in treating this when it's not pathological? I always believe psychiatrists deal with human beings. No science in medicine combines neurobiological and scientific understanding with human understanding as psychiatry does. So we do not necessarily always treat everything that is pathological. As psychiatrists, we treat a lot of normal phenomena in life. Mother-in-laws and daughter-in-laws having problems are managed by us. We also manage issues related to academics, which may not be pathological. We manage parent-child issues, which are not pathological. We also manage breakups, romantic losses, which are not pathological. So it's our job to manage anything that causes anguish, trauma, stress, worry to every human being. What should we say to this person? I normally begin by asking them, what do they feel went wrong in the relationship? And initially, many of them say, I don't think anything went wrong. Everything was fine. And I always tell them that no one breaks off from a relationship for no reason. There would always be probably something which is an issue. And then very often they'll come out and say, we were always having problems, but we used to push it under the rug and never talk about it. So you come to know that there was always something which was there, something which was worrisome. Another thing we always tell the person is, what have you thought of ahead? Of course, you may not do this the first day they come to you. You may do it at a later date, but you always ask them, what have you thought of ahead? And gauge how positive, how hopeful, how optimistic the person is. Gauge how pessimistic the person is, how negative the person is. It's a very important thing for you to gauge. Initially, if the person comes with a lot of anxiety, yes, I may prescribe clonazepam for a short duration. I may prescribe an SSRI for a short duration. I may prescribe something for sleep for a short duration in the acute phase, probably for a week, 10 days to 15 days, maximum a month. What should we say to the family? Very often the family comes to you and says, Doctor Saab, isko kaise bhi isme se bahar nikal do. I always remember a 10th standard girl was brought to me and the parent told me, I'm very upset and disappointed that my daughter has fallen in love. And now, of course, she's upset and sad. She's in the middle of her 10th standard and that boy has broken off from her. They've had a fight. I've sent my daughter to a convent school. How could she ever fall in love? And I always tell her, God is very kind. For every girls' school, there's always a boys' school nearby. And both leave at the same time. Similarly, colleges, for every girls' college, there's always a co-ed college nearby. Both leave at the same time. Relationships will blossom. People will fall in love. It's normal. It's very important to tell the family that this is not pathological. Breakups are normal. It's very normal for the person to fall in love. It's very normal to face rejection. Tell the family to be supportive and not critical. Tell the family not to tell this person, you know, you brought disrepute to the family, to the religion, to the whole colony. No, don't talk in those terms. Be as supportive as you can. There may be some unreasonable demands by the patient who comes to you with a breakup, or the individual who comes to you with a breakup. They may ask you to try and phone the person who has broken off and try and, you know, get them back together. That is not our job. They may sometimes tell you, you know, would you talk to him and tell him that I am undergoing a lot of psychiatric issues and I'm under your treatment. Maybe he'll come back. That again is not our job. They often want to know why the breakup happened and they want you to phone and find out. Again, that's not our job. Our job is to deal with the person who's come to us. It's also very important that we deal and we bust social and cultural values which are wrong. Values that inculcate guilt are not needed. We promote the positive ones, but we also bust the ones which are negative. It's also important to know that information may be hidden from us. They may hide things as to whether how long they were together. They may tell us 6 months, it may actually be 2 years. They may hide the fact that physical intimacy has happened. They may hide the fact that there was violence between the two. They may hide the fact that there have been fights between the two. They may hide the fact that both of them were probably cheating on each other. So these are things which we have to also explore and probably find out. It's also very important to realize, is romantic loss actually romantic? Or is it more of a loss of ego, which the other person feels because of being rejected? Is it because of the fact that I was rejected and that hurts the ego far more than the loss of the romantic love component of the relationship? This is something we need to explore and find out. Another angle that makes handling post breakups very difficult is relationships these days are harder because conversations have become texting, arguments have become phone calls, and feelings have become status updates. Time and again, I have people who come to us and say that, Doctor, yesterday I messaged him 10 times and he has sent me rude messages. He sent me dirty messages. Please go through. These are the messages. They either show you their phone or they come to you with printouts of messages and they expect you to advise them on what to message him, what to tell him. Or they'll say, he has told me this, what should I tell him? You're not there to be their public speaker. You're not there to advise him. You can advise him in general. You're not there to advise him what to text. You're not there to advise them what to say. You can probably guide them as to what they should do and what they shouldn't do. A very important area that we may see as psychiatrists in a post-romantic breakup is revenge pornography. And that's something that we see a lot nowadays. Very often couples who've been in a relationship may be intimate physically and make a video of it. And this may later be used by the partner who is probably breaking off or being cheated to take revenge on the other partner. This can also be used to file false molestation charges, abuse charges, multiple other things. And this is something that couples have to be careful of. It's a question that I always ask everybody in a post-romantic loss. A, how long have you been in the relationship? Was there physical intimacy? Was there a video of your physical intimacy being made? Were there videos and pictures of you together all over the internet with friends? Were there pictures of you in compromising positions? These are things that you have to ask, because sometimes they may come to you for help only after this envisages itself. They may not come to you before that. So this is something we have to be aware of in the common era. We're living in an era today where we capture moments using our phones, which is more important than actually living the moments with whoever is beside us. This is something which is very important. And this is another thing that I always tell, because the first thing that you will get, another coping mechanism that a lot of people show in the post-romantic loss and breakdown, is to go online and find someone to date. And they very often ask me, doctor, is it okay if I go on Tinder and find someone? Is it okay if I go to some dating apps and find someone? And I very often tell them, you never know who the person is. You never know what you're going to get into. And you're probably finding a stopgap solution, but it's not going to be a long-term solution for you. The best sign of a healthy relationship, I tell people, is no sign of it on Facebook, Instagram, or any other social media. And very often, most of the times, people are upset in the romantic loss because they feel, what are people on social media going to say to us? Because it was written that we are together in a relationship. Now we're no longer there. Photos of us which were on social media have now been removed by the other person. I have been totally sort of removed from his Facebook account, removed from his Instagram account. He has blocked me on WhatsApp. These are things that sadly hurt the person far more than the romantic loss. This is something I always tell youths who come to us, who very often use social media either to malign the other partner or gain sympathy. And I always tell them that bragging about your relationships on social media is a form of dependency on your peers to find acceptance on your relationship status rather. It's your relationship, not the rest of the world's. It's very important that you don't find solace either in your rejection, you don't find solace either in your breakup, you don't find solace even during your relationship on social media. This is something that is what we have to adhere to, and this is something that would not be valid. So we finally have to do the job of mending the broken heart. 3 things we have to teach them. This is not the end of the world. There is a life after this, and you will probably find someone else after this. Love will always come back to you. It may have left you for now, but it doesn't mean it's going to leave you forever. Very often they say, sir, the next time I fall into a relationship, can I come to you and seek advice beforehand or during the relationship so that this doesn't happen? I give them tips on what went wrong in the current relationship and how do they manage it in the next relationship. And I always tell them that the brain and heart are linked. So anything that affects your heart will affect your brain. Anything that affects your brain will affect your mind. And you're bound to face all the emotions that you face whenever a breakup happens. I also tell them it's important to pause. Don't get into a hurry of getting into the next relationship. A lot of people say, I'll find a more handsome boy or a girl. I'll find a more good-looking man or a woman and show that person that, you know, I have someone better, and go right in front of that person and walk as though nothing has happened. I tell them, pause. Before you get into your next relationship, dekho, socho, samjho, think. Think of the mistakes you made here, think of what went wrong here, and then decide before you get into the next relationship. Well, there are different ways to heal a broken heart, and we do all 3. One, of course, is what we do, the acute management. We stitch it up slowly to therapy, but we also tell them it's time that will heal a broken heart. We often tell family members, don't think she's going to be okay or he's going to be okay in 15 days and 1 month. It may take any time between 15 days to 6 months or even a year sometimes for the person to come around. Each one has their own way of coping and each one has their own way of resilience. This is a breakup checklist, which I very often tell people, and everyone, irrespective, man or woman, do not contact the person who's left you again and again. It's very important. If you feel that you want to write them a letter, write it, but tell them there's no further communication. You want to do it, it's your choice. Join a social group, find new friends. Spend time grieving. You are in that relationship. It's perfectly okay to spend time grieving and feeling bad about it. Unfriend them, yes. Do not be friends with them. Do not expect them to message you. Get a makeover. If you want to look different, look different. You want to look better. Get yourself in shape, yes. Plan to do something alone or with your friends. Attend something that diverts your mind, like a comedy or a film that you like. Take a holiday if you need to. Pack up any mementos, any memories that reminds you of them. Rearrange your house if you have to. Rearrange your room if you have to. Rearrange the way you sit if you have to. And set a goal as to when you're going to get over this in the long run. These are few things on the checklist that if followed, go a long way. It's very important during the process not to allow others to tell you how you should feel. This is something I always tell people. You have experienced a loss. It's all right to grieve. Don't let others tell you कि एक महीने में तुमको ठीक हो जाना चाहिए. It is your choice. If you take 3 months, take 3 months. Don't let others tell you, अरे ये तो कुछ भी नहीं, ये तो होते रहता है, छोड़ो हटाओ. No, they're not supposed to tell you that. You have to take your own time to come out of this. It's something which takes time. And yes, in the long run, I always tell them that love is what is going to heal you. Love in some form, love for something is what is going to heal you. And remember, most of the stress that comes into your life comes from the way you respond and not the way life is. If we help them fix their attitude, all the extra stress is gone. We don't need to worry at all. All the extra stress goes off. So few things which we do is the therapy angle. We reinforce trust in love. We do not do a retrospective analysis in detail of the relationship. Very important. Focus on the present. We focus on now, not on the past. We focus on removing any shame and guilt. This is very important. Any shame and guilt that they may have had with regard to the relationship needs to be removed. Focus on removing hate and revenge also, because these are negative emotions that will keep on making them hold on to the relationship. Focus on the future. It's very important. Focus on learning from their relationships. Very importantly, give up the past and speak to family members. Speak to anybody in the family who you feel can listen to you and hear you out, who's sensible enough to give you the most sensible advice. There's no particular school of therapy. Like I mentioned, you assess for psychopathology, but don't look for it always. Assess for negative coping mechanisms like self-injury, substance use, hate porn, social media. Assess for rebound relationships. Do not allow rebound relationships to happen. Assess for the role of other complications, like I told you, like revenge porn or domestic violence or abuse that arises out of the relationship. Prevent using the wrong resources. Speak about dating and relationships in general to the person. This is very important. Do we use medication? Some of them may need medication, but for a very short period to help them cope. Medication is not the cure. It's only a mechanism which helps them cope better and come out of this better, makes them more amenable to therapy. Self-love. I always tell people, what you want today may not be what you want tomorrow. What brings you joy today may not be what brings you joy tomorrow. That is why life changes, and when you keep going in the direction of self-love, desire, and joy. But the answer is not to deny yourself your wants. The answer is to let your life change. It's something which is very important. And lastly, I will end by saying this, that it's always better to have loved and lost than to have never loved at all. Thank you.
Thank you so much, Dr. Avinash. That was really a very interesting talk, and I love all your syndromes. We've got some new names for all the syndromes, Badle ki Aag, Devdas, and but very, very relevant, and yes. And there's so many questions out there. So I think, Amlan, if you would like to say something.
Practical answers and based on scientific understanding and evidences. Yeah, I also did like the syndromes and how Dr. D'Souza has classified them. But more importantly, all the practical approaches that we all face while dealing with this sort of patients. So that was quite interesting. We have been seeing questions pouring in. So let's deal with the questions, and over to you, Amrit and Ali.
Thank you, Amlan and Simi ma'am. Avinash, a great presentation, as always. Someone mentioned in the chat box, it is an offbeat topic for a core psychiatrist. So I think there should be a lot of questions, and we are seeing. I think we'll Amrit, we have to do.
There is nothing, Alim. There is nothing offbeat about it. It is a very, very pertinent thing. if you're practicing with, in the current generation with older people, younger people, heartbreaks are very, very common. People losing in relationships, a lot of things. Everywhere you cannot live psychiatry without, tending to a broken heart. I think at the end of the day, you talk about neurobiology, you talk about any type of biology, but the heart is always connected to the brain. That's how Avinash summed it up very beautifully. So we'll come to the question. There are a lot of questions. So I'll ask the question that were always in my mind that has come in the chat box. So Alim, you start or I'll start?
Yeah, there was a question. How do you assess healing?
How do you assess?
Healing.
Well, I think I always believe that the biggest marker of healing is the person himself. When he comes and tells you that, now I think I'm out of that relationship and I'm absolutely, better and I'm absolutely fine. And I think now, I'm past what has happened to me. I think there's no greater marker than that. I don't think we have a checklist or we have a scale for healing. We have to go by what the person says.
That's a beautiful question, Avinash. And actually it has been, in my mind for a long, long time now. So it is one issue of replaceability. A person loved is readily replaced by the other, fully or partial. How to create a narrative of loving more than one person at a time? I see a lot of people who are true to two people in their life. And I see a lot of people who are not true to even one person in their life, a partner.
Well,
are we biologically tuned for just monogamous relationship, or it is just societal pressure and expectations?
Okay, now I think this is a very personal take, which I'll give you, that I personally think that you can never be true to two people. You will only be true to one person. So it would be, you can, always probably, say that you have multiple people in your life, but my personal take is you can truly be in love with only one person. That is one. Secondly, what's very important is that, it's very easy for us to say that man is polygamous and that, but then those are flings. Those are affairs. Those are not necessarily romantic, intimate, pure relationships. Whereas when we talk about pure relationships, I think they probably happen once in a while. They probably happen once in a lifetime. And so this is my personal take of what I have seen of love and relationships. They can, come at any point of time in your life and they can last forever. So I wouldn't agree with the fact that, the narrative of multiple relationships. Yes. And I also believe that no individual is a replacement for any other individual. So if someone thinks, it's a replacement, then it's a very wrong notion that they're probably carrying. I believe each one is his own. So you probably can't, replace anyone. No one can replace anyone for that matter.
Sir, what about somebody having 2 kids, somebody having 7 kids, and somebody having 1 kid?
Well, I think, that's a personal choice of,
No. So we are not talking about personal choices. I am asking if somebody has 1 child and has another child. So is the parent not true to the first child when he has a second child?
No, see, I'll tell you, you're talking here of romantic love and we're talking there of parental
love.
We
are talking about feelings, we're talking about emotions. We are given it a name.
Right.
No, we give a name that when I love somebody, main behan bana deta hu. We see a lot of names coming in romantic relationships also. So are we cheating ourselves in calling all these things, or are we?
No.
Just because of societal pressure.
So now I'll tell you the core feeling that we're talking of is love, which can have various dimensions. You can have romantic love, you can have brotherly love, you can have fatherly love, you can have motherly love. So there are multiple facets to that emotion called love. Now, if you say that someone, has 2 children or 3 children or 4 children, well, I think he probably, the parental love given there is something which is very different. Whereas, when we are talking here of romantic love, we're not talking of parental love. Parental love is something that can be spread, and it usually gets spread more and more. It's there even towards your children's friends. It's even there towards, other your relatives' children. It's very often there. And that's because it's probably a love which is supposed to be infinite. Even romantic love is infinite, but while it's infinite, it's also finite in the fact that it's restricted to a particular person.
Okay, thank you, Avinash.
Yeah.
Avinash, suppose teenagers are involved in a relationship.
Suppose seniors.
Teenagers.
Yes. Okay.
Teenagers are involved, and in this case scenario, mostly the parents become villains and they get aggressive towards each other, both these parties. So how to handle this?
Well, we have seen cases like this, and in such cases, I think the teenagers have acted more maturely, and they've actually told the parents that if we are going to be the cause of you all fighting, well, fine, we won't be together. And they probably waited for a time when they get more mature, they get more, and they've remained in touch, and they probably come back together at a later stage. That is one way. The second way is sometimes, yes, the parents may forcibly sort of just separate this couple who's probably in love, and that can happen. That can lead to a sort of romantic loss that does come up. There's a whole cultural caste angle to it also that comes up very often. Apart from that, I think what's also important here to know is that I think it's more of the folly of parents at times that they don't seem to understand their children's feelings, and the fact that love can happen. And a number of parents I meet have this notion that it can probably happen only once he's 22 and he has a job, and it can't happen earlier. And I think these are things which probably parents need to change in their thinking.
Amrit.
Two or three interesting questions have come up, and that's very important in nowadays clinical practice when we talk about homosexual breakups. And I find those are much more intense. Managing them is much more tougher than managing a heterosexual breakup.
Okay.
So are we having some different methods in which again, how do we deal with these things? And I find a lot of people becoming suicidal, and mostly in homosexual.
Well, I think
breakup.
I always have believed that LGBTQ plus relationships and love in those relationships is similar to love in heterosexual relationships. It's not that, but the LGBTQ plus population has their own issues, particularly because of the stigma they face, because of the way society looks at them, because of the fact that there are not many mental health professionals who are very cognizant with their needs and can deal with them. So this is something which we definitely see, and therefore their chances, and very often I'll tell you what's also seen is that it's not very easy. Their dependency on their partner is far more in a romantic relationship. Why? Because probably that's the only support they have. When their family doesn't support them, their friends don't support them. So therefore the breaking off in that relationship may lead to more suicidality. This is my thinking. And it would need to probably be handled more acutely, more psychiatrically and therapeutically. Definitely, I agree.
Avinash, is it normal to have a graceful breakup? There is a question in the chat box. Is it normal when the separation is gracefully done with mutual consent?
It does happen. It's not very common. It's rare. But if the individuals are mature enough, it can happen, and they realize that, okay, we've reached a saturation point in our relationship where we can't go along. And, we probably, let's not fight and let's not get dirty and murky, and let's just decide to move it. And we still stay in touch with each other occasionally. And it does happen.
Yeah, I'll get back, Avinash.
Yeah.
When a patient, there are a lot of clients who come with broken relationships, and they tell that they keep a window open. They might have blocked them in Insta, they might have blocked in Facebook, WhatsApp, but maybe the Snapchat is open. So they keep the window open, and many times people tell that let us break up, but let us be friends. So if you really have to give advice, what will be your general take? Should there be a window open anytime, or it should be closed?
Okay, so the issue here is, are you all mature enough to handle yourselves post this breakup? Are you looking for that door of friendship with the aim that you're probably going to relive, and that rejuvenation fantasy that this relationship is going to come back? Or are you keeping that window open so that, yes, as mature people, because we did know each other very well at one time and we were in love with each other at one time, we probably will be of help to each other if we are in a crisis at some point of time, and will be mature and gracious enough to help each other. But I think the second part is very untrue. A lot of people keep that window open because they are in that fantasy of regaining the fact that this relationship was lost and it can be regained, and that doesn't happen.
Alim, I'll finish, then you come. I was talking about the romantic relationship, and there are a lot of questions about how do you define romantic love. Is sexual interest important in romantic love? This is Dr. Ruma has asked this question.
Okay. Well, I personally feel sexual interest may or may not be a component of romantic love. It's not that. I mean, there are a lot of people I know who have been in romantic relationships for years and have not been physically involved. as yet, and they believe that, you know, it's their company, it's being together, it's the whole intricacy of the relationship that matters. The sexual intimacy is one component of romantic love. It's not necessarily a required component.
Thank you.
Okay.
Thank you.
Avinash, a question in the chat box. Does going through the minute details help in the grieving process, or should we avoid going into the minute details? Suppose the relationship over, so should we go into the minute details, or should we avoid going into it?
Okay, now my experience is that everyone who's been through these relationships, breakups, want to talk about it. It's not that they don't want to, but they're probably not ready at times to talk about it. So I generally ask the person concerned, you know, whether you're in a position where you want to discuss details and talk about it, or you don't want to. And very often, if they say, yes, we want to talk about it, it's a good chance to give them that catharsis and let them speak. But if they feel they are emotionally not ready, we probably wait for a time when they're ready, maybe a few weeks, a month, and then allow them to speak at that time. There are some who say, I'm able to manage it and I don't want to discuss certain aspects of it. We respect that. But at the same time, we make them realize that not discussing it would leave those things within them. And probably they would have not discussed it with someone who can scientifically handle it, like how we handle it. So we leave the option open to the person who comes to you.
Yeah. Yeah. You talked about revenge, you know, love, you know, revenge in love. That's a very, very important aspect. Like I had a patient whose girlfriend, he broke up and the girlfriend was going to get married in Meerut. So he had bought a gun to shoot the boy and the girl on the marriage day. But, you know, I was at my wit's end. What should I do? But finally, I had to inform the police, and he was stopped from boarding the train in Bhubaneswar. He was a little delusional, and we see a lot of people like this. So there's a question in the chat box. So what is the legal significance of coming across information about committing a crime or expressing ideas of doing one during our therapy for romantic loss? How do we manage such things?
Well, I think if we feel that there's someone who's going to be a danger, you know, or there's going to be an homicidal act that's going to happen or a violent act that's going to happen, I think it's our duty to inform authorities. It's our duty to even inform the other people concerned, and they should take action. So I think, yes, definitely that legal angle is there. We're bound to inform. We cannot just keep quiet.
Thank you, sir.
Yeah, Avinash, there is not a question but a comment that personality disorders, people with personality issues are more likely to bind up. These relationships are more likely to break up. Schizoid, obsessive, paranoid traits could be there, and lack of poor social skills, especially in dealing with the opposite sex. This could be a reason, and ability to trust and emotional maturity. So all these things. So can you give your comments on this angle?
Yes. So see, one of the reasons why some people don't do well in relationships, very often there may be this whole personality disorder component. But I would not say that everyone who's had a breakup has a personality disorder. You know, we can't really put it that way. You would assess. And, you know, if you find there's someone who's had a breakup and is resorting to substance use, self-injury, multiple other things, and yes, you would want to look at, or even for that matter, you know, sexual promiscuity being shown everywhere, you would want to look at a borderline personality configuration in that person. If you have someone with revenge, murder, multiple things, you want to look at an antisocial personality or a schizoid or a paranoid component. So you would want to assess that, no doubt. But I wouldn't always say that everyone who can't maintain relationships has a personality disorder. No, I won't go by that adage.
Okay, and who should be taking up these cases? Psychiatrist or some other mental health professional?
Well, I think every mental health professional should take up these cases. You know, it doesn't matter whether you're a psychiatrist, whether you're a psychologist, whether you're a psychotherapist. You know, the person needs help, and we have to be there.
Okay, thank you, Amrit.
Yeah. Another very important aspect you have discussed, and I am actually glad that you discussed all the points. Most of the points we come across in our clinical practice. So one of the things is the ego thing, that even though I know that this relationship is not right, not fair, I'm in a toxic relationship. And, you know, the terms people use nowadays, it will, you know, we also don't know a lot of terms. They talk about toxic relationship. Even then they know that this relationship is, you know, not right. But just because, you know, X has left me, I cannot accept it. I had to leave him or her. Why did, you know, and that it becomes an obsessional thing. And many times it's very, very difficult And I'll tell you, in my routine practice, in spite of the therapy I gave, I also gave a lot of medications, sir, in terms of anti-obsessive, in terms of antidepressant. And I assured them that in 3 to 4 months or 5 months, we'll get a lot of difference, because sometimes it's very, very difficult to manage. It's so obsessional, they can't study, they become suicidal. Sometimes it's as if at the end of the world, we talk about parents, we talk about family members, we talk about pets, we talk about siblings, but no, nothing. That one relationship that has gone wrong, it makes them feel that it's the end of the world. So it's very, very tough call, giving medication. So how do you balance it, Avinash, in your practice?
See, I generally tell them that, see, there are two aspects to the problem. One is the breakup, and two is the consequences of the breakup. So I said that I'm not necessarily saying that, your son or your daughter has a psychiatric problem, but she's developing a psychiatric problem as a consequence of the breakup. And the problem is this, and these are the symptoms. Now, if he or she came to me with these symptoms and this problem, this would be my approach to treatment. And I would want to handle that along with handling the loss or the breakup, because if I don't handle this, they won't be able to be in a position to think and handle the breakup itself. So, and very often when I do that, I mean, parents agree. And very often if you tell them, like, the medication is going to be for a 3 month, 6 month period, maximum a year, they are quite open to the idea. Their worry is about side effects. They're going to Google your medication. They're going to come back to you with queries. We have to be ready to answer their queries. And of course, we're not going to put them on a long list of medications, probably 2 or 3 medications, which we feel works best, or 2 or even 1, depending on the case. So we tell the parents that this is what we need to do. And we tell the adult in question that this is what we need to do. And very often they agree. And we tell them this is just to prevent further breakdown.
Thank you.
Okay. Okay. If a person is having multiple breakups, so what will be your take on that? Have you encountered such persons?
See, multiple breakups do happen. I mean, but then, it depends. I mean, if you're talking about, see, multiple breakups with different people, they do happen. So people who have short-term relationships with multiple breakups, I would want to assess for psychopathology, assess for a personality disorder component. And, try to look at probably, if that's not there, then I would want to look and find out whether the basic handling of relationships is not proper. And then probably work on that, or communication style isn't proper. There's something going wrong somewhere.
So the question is a little different. How to handle multiple breakups with a single person?
So, well, we've also seen that, okay, we were together, then we were not together, then we're back together. Well, I think in such cases, I would want to assess both members of the couple, and try and find out what's going wrong. Where's the need for such vacillating closeness and distance, in the same relationship? And we probably would need to say whether, whether each of them are fueling their egos, or for that matter, fueling their desires, or for that matter, just probably feeding off themselves like parasites. We need to probably look at that.
What is your take on live-in relationship?
Well, I believe that live-in is here to stay. It's something which is there. We can't do away with it. I'm not the type who's going to say, yes, you all must get into a live-in relationship. No, but I'll say again that, it's something that is there. It's a trend that is now there. It's there to stay. Even parents have accepted in most cases that this is going to happen. Adults prefer that. And well, I think, yes, we have to just accept that it's another facet of relationships rather than look at it as being pathological. It's definitely not pathological.
Yes, sir. Dr. Mohandas is there, sir. Any comments from your side?
I think when Avinash talks that, I don't usually comment because he's my boy. He will talk sense. But if I may add something, Avinash, will you get?
Please, sir. Please add, sir. Please add.
When we talk about romantic love, there are 2 terms: romantic and love. You go through the etymology and the history. What is romantic about romantic? Is it from the Roman? There is a history. Okay, why it is happened. Love, how the word has come. Basically, it has come from one of the Sanskrit words, and it means desire. Okay, romantic, it can be correlated to eros, But the Greek classification is different. 4 types of love. The romantic love can be before marriage, even after marriage. After marriage also you can get new couple, they come, they cannot adjust easily. So the so-called romantic love doesn't mean that it is only before marriage or relationship. That's the way I look at it. Secondly, the type of cases that we get usually adjustment issues before marriage and after marriage. And majority, as you have rightly told, the one is having classical personality problems, especially we call it borderline personality disorder. I feel borderline personality, the word itself is wrong. It is a broader zone personality. There is no borderline. It is a broader zone personality, emotionally unstable personality. I mean, I will not go into details. Similarly, the boy also, the other person may be a passive aggressive or may be completely normal. And as you have rightly told, the majority of the romantic love failures, many people with normal personality traits may be there, no disorder. But when they come to us, I have seen majority, especially the female sex, I've seen mainly borderline issues too much and suicidal, deliberate self-harm. And somebody has asked about grief here. It is also initially a grief. Then when it goes to the pathological grief, that is the sequelae that you have already told. But unfortunately, the classification, DSM classification, heavily dealing grief with depression. I will not go to the nosology and the confusion classification. There is so much problem about the wording. Okay. One grief, basically, even we call it post-traumatic stress disorder. One term. That's the etiological thing. Post-traumatic, there is a reason for something. But usually classification is phenomenological, right? Many of our classifications are phenomenological, DSM-5, ICD-10. But there are some areas in the classification, you go to an etiological link, okay? You can think over it. And I liked your thought process, your different typologies. People can have different multiple typologies. People have told multiple relationships. Similarly, multiple thought process can be there. There is no single answer. Okay, people are different. And if you can go through, there was only one good article which has come a decade back in neuroscience letters. That is called the neurobiology of romantic love. And there are so many other loves, the theories, biochemical variables. I will not talk about anything. Okay, thank you very much. Sorry, I have bored you enough. Okay.
Thank you, sir. Thankfully, you are on Earth today, because that day you were on Mars.
Yeah, Mars. Last time,
Yeah,
what happened
in your
is that is my ignorance, my dear. Last
Thank
time,
you.
it was a new computer which I started. I didn't peel off the label of the camera. So that is, at this computer is the old one. The new one, when I called the computer repair thing, they told that, sir, you have to peel off the this thing. That is the tragedy. But I answered you, I was in Mars at that time.
Thank you, sir. Amrit.
Question.
Avinash, one question.
Yeah.
Amrit, you can go ahead.
So there are unique arguments on over medicalization and pharmacolization of normal human experiences and lives givens that is present throughout the globe. Many of us never felt the need of a psychiatrist for such breakups. You know, if you look at 10 years, 20 years down the line, the breakups were much, much more severe than the breakups which are now, because you get partners very easily. But the reactions to the breakups are much more severe nowadays. You know, if you look at the externalizing behavior of the breakups, So what is your take on it? I wanted the question to come up.
Okay.
That's why I told that we use medications.
Okay. Now, see, first thing is, I don't agree, Amrit, we get partners easily. Okay. I have a lot of people who come to me and say ki they've never found love. That's also, that they've probably proposed to a few people. Everyone has said.
I'm talking about partners.
No. Okay. Yeah. Okay. Yeah. No. That's what. Now, the thing is, apart from this, see, I believe that, I can vouch and I can say that, over medicalization never happens. I believe purely that, if someone needs a particular medication, he needs it. Now, it's the psychiatrist will prescribe. He's a doctor, he's trained, he's scientifically sound. And if he feels that the person is going to benefit from an antidepressant, so be it. If he's going to benefit from an anti-anxiety medication, so be it. Now, very often it is, people who have these things that, I'll get addicted, I'll get dependent, there are side effects, liver kharab ho jayega, kidney kharab ho jayega. This is what they go with. And then they think the other myth that, a psychiatrist is only going to prescribe something to knock me off, put me to sleep so that, I forget about this problem. So it's only when I prescribe and I tell the patient, take it for 3 days. Tell me if you felt knocked off. Tell me if you felt upset. Tell me if it worked. And they come back and say, no, I've slept very well. In the day, I was very alert. I've never had a problem. Mood-wise, I feel better. And I agree that the medications are helping me. So I always tell them, take it for a week. See how you feel. You can always stop it if you want to. But take it for a week rather than not take it. And many of them agree. They say, we'll take it and see. And they take it and it works.
Avinash, how to make the painful memories less painful? Because sometimes people say कि sir वो मुझे भुला दो. I do not want to मतलब memory साफ कर दो. So how to handle this aspect?
So there are two things here. One is I tell them there are two ways. One is we can talk about it, we can discuss about it, and we can find out why they are painful and remove that pain component which is there. The second aspect is that there is no way to forget about them. There's no treatment I can give you. So, and I always say that even for that matter, the, treatment that we have, like any brain stimulation or ECT, is not going to help you forget painful memories. So there's no treatment. Now, when you talk about them, I tell them, where is the pain? Is the pain outside or is the pain within you? The pain is very often within you. That's why the memories are painful. It's not painful for anyone else. It's only painful for you. So we need to look at replacement of those memories by other things. And it's going to happen over time. I tell them it's going to take 6 months. They will wean off. It will go off. I said, if India wins the World Cup, okay, we're going to talk about it for the next 1 week. Then after that, slowly we'll talk less about it, then less about it. Then we'll have a new series that starts. Same thing here. The memories are going to go slowly.
Okay, thank you. Amrit.
How do you deal with breakup in polyamory?
That's not my area of work. I can't really comment about it.
What is love, sir?
Well, love is when you feel for someone, like someone, you feel like being with that person. When you see that person, dekha jo tujhe yaar dil mein baji guitar, that is love. What else? I always tell people, you don't need a definition. You will realize it jab hoga. There's no one can define it. Textbook definitions and all don't make sense. When you feel it, you will feel it and you'll realize it.
If Amrit का दिल में 4 जन को देखने से गिटार बजता है और अलीम का दिल में किसी को भी देखने से नहीं गिटार बजता है, तो can you call that I might be in love with 4 people?
गिटार 5 मिनट के लिए बजा तो चलेगा, गिटार पूरा दिन बज रहा है कि नहीं ये देखना है.
At 4 different times I see 4 different girls and
तो उस समय के लिए बजा. अगर
बजाना सर, बजाना
तो नहीं, बट चारों को लेके पूरा दिन बजा क्या, वो इम्पोर्टेंट है.
वो तो एक के लिए भी नहीं बजता है किसी का सर.
So then that's not
6 महीना बजता है,
so that's not
8 महीना बाद कम हो जाता है, 5 साल बाद फिर कोई बजाता नहीं है, एक दूसरे का बजाते हैं. So that is how even then we try to call it love, sir. Is it fair?
No, it's not that. I think, we feel happy to, everyone is happy to say I'm in love. No one wants to say, no, I'm not in love at all.
But are they happy in love?
See, वही मैं कह रहा हूँ ना कि we like to feel happy. Whether we're happy or not doesn't matter. मैं तो खुश हूँ. We don't want to say I'm unhappy. No one wants to say I'm unhappy.
I think
there's a question about blackmail.
I think Dr. Simi wants to say something. I think Dr. Simi wants to say something. थोड़ा सा hold.
Control.
Control. Control, Amrit.
Amrit abhi philosophy पे चला गया
हाँ,
है.
yeah.
है ना?
Yeah.
What is romantic love? What is, there's so
No,
many
there are a lot of
aspects.
questions, madam. In the chat box, there are a lot of questions on this. That's why I just put my example and just gave it. There are a lot of questions on that. Because I think we have to deal with these things also. People come and ask. So, Alim,
So maybe
I
carry on.
think Dr. Yeah, Simi ma'am wants to comment something. I think you typed also.
I think carry on with the questions if you want to.
no, I think we'll take one or two more questions, Alim. And then we'll give it to the chairpersons. They can speak a little. Those are important topics. I think the chairperson should also be allowed. So there are a lot of questions on blackmail, madam. You have replied on the chat box. Can you just elaborate?
Yeah, that's what I wanted to invite her for. Simi
Yeah,
ma'am.
someone's been asking about fear of blackmail, and especially when there's a sexual relationship. And I think over here, like Dr. Avinash has already said, if there is a video or something concrete, then definitely one should report it to the police, and it is a crime. And otherwise, a sexual relationship is okay. It's a part of a relationship. And if it happens, it's normal. So we as psychiatrists and we and doctors, we have to normalize this also for many people, because in India, there's a lot of guilt attached to it. And that further leads to worse depression. They can't talk to their family members about it. They can't sometimes even talk to friends because of that fear. So then, of course, like she said, it happened twice. So then also we need to see the reasons why it happened twice, what to do about it now. And sometimes we need to identify the support systems of the person and, go beyond our boundaries of just being a psychiatrist and helping out that person in that way. And the problem here is we don't have psychosocial workers and other people who would maybe do that for you in other countries. And so, we have to be the psychosocial worker and psychiatrist and everything.
Thank you, ma'am. Amlan, comments from you?
Well, I think it has been comprehensively dealt with by all the questions, and Avinash, Dr. D'Souza has answered them well, especially about what happens after a breakup, the psychological aspects, also the social aspects, and some legal problems as well. They were all dealt with. I think the questions were also very interesting. Some of the questions were answered in chat box itself. Only thing which was not answered is what love is and what love is not. Mainly the questions were asked by Amrit. I don't think we can have a solid answer for that. We have to wait for decades to find the right answer.
It's a trick question, yeah.
Yeah. Apart from this, I think all the practical aspects that as clinicians, practicing clinicians, we need to know have been dealt with. I'm really happy about the fact that few of the social aspects were also discussed. I must say that most of the questions we face in our lives, in our clinical practice, but also our colleagues, the gynecologists, even the endocrinologists, young females often see endocrinologists for a different reason. And then they confess about the problems. They call, the other colleagues call us up about how to deal with them. So it will be a good idea if we can discuss this with our colleagues from different professional, different disciplines, and send a message about how to deal with them. Because these are the problems other colleagues are also dealing with. And they should have a clear-cut idea about how to go with it and when to refer them to us. So that's my only suggestion that we can make to this forum.
I'd like
yeah, Simi ma'am, your comments, please.
I just like to say over here that, this is a very important and pertinent topic. And like someone said, it is very relevant. I mean, as psychiatrists, we will be seeing all this, and we are seeing it, and we see it every day. And so sometimes when we start off in our professions, we tend to not talk that much and not say too much when we are talking to someone. We'll just write medication and give it. But I think this is also very important to understand how to provide that support, how to not let our own biases in, because these are situations where our own biases can creep in. I remember this one person who had come, and he was talking about how, he had been in an extramarital affair and faced a loss. And when he went to a psychiatrist, the psychiatrist actually told him that, what you did was a sin, and it's incorrect. And that person said that, I was already going through all that trauma. In fact, he was a doctor himself. And it was really difficult for me after he said that. And I was even suicidal. And so we need to deal with our own biases, be aware of our own biases in these situations, even with LGBTQ people, even with people who may be, not monogamous, and we may believe in true love, but there may be a person who has not been monogamous, but still is shattered by the loss of a relationship or of a loved relationship. So we need to put those aside and to be able to see how to talk to each person. That is what I think psychiatrists are best able to do. There are very few trained clinical psychologists. I think there are even fewer than us. The most of the people out there are untrained, and I think in all our cities we do see a lot of bad practice also going on. So having these discussions is so important, because a lot of psychiatrists here would become more aware of their role in it, and how to be more effective in our practice. It'll make us more effective in our practice with the LGBT individuals, with someone who's monogamous, someone who's not, someone who's been in multiple relationships. The basic thing we have to see, and I think what Dr. Avinash has said, is we do need to provide them with all that, a breakup kit, what to do and what not to do. And for that person to know that there is a non-judgmental therapist over here who's not telling them what to do. We are not there to tell them to live their life, but just to help them make their own decisions in a better way.
Thank you, Simi madam.
Thank you.
Amit, I think we should invite Tufan sir now.
Tufan sir.
Thank you. Now we are towards the end of this program. First of all, I compliment Avinash. It has been a splendid presentation. He has dealt with many aspects, and rightly he has not tried to define romantic love or love as such, because I believe there cannot be any definition. If you scroll down the scripture, scroll down anything, you will have a number of definitions. And in most of the definition discussion today, we have focused assuming that loss in romantic relationship, both have been normal individuals. But there can be a psychopathology who can be causative of the loss of romantic relationship. And maybe, suppose there is a loss, one of the partners may be having a psychiatric disorder, formal psychiatric disorder, unknown. I have seen in many cases that becomes a reason. Or there can be undetected psychiatric disorder, which when interaction becomes intense, they realize that, okay, oh no, it's not difficult, it's difficult to adjust. I will quote only one case, just very few days, some months ago. Engineer, he was having a romantic relationship with a girl. To this extent, the girl came from Mumbai to settle down in Bhubaneswar. But within first 1 month, he was very much exhausted by the tantrums of the girl, breaking mobile phone without reason, and they parted. After they parted, this boy went into depression. And when I took the history back, the boy was also having affective problems. The girl was having affective problems. In these factors, what I intend to tell is that one has to look for these factors also. We cannot just assume, because it will be there in many cases. But thank you very much for your presentation. And as a psychiatrist, when we deal a case, it has to be personalized one. For every case, the scenario can be different, and our approach has to be different. And everything has to be done in good faith. And dear Avinash, long live love and long live your expertise.
Thank you. Thank you.
So I'll give the formal thank you on behalf of the IPS Odisha State Branch. Avinash, congratulations. Difficult topic, offbeat topic. Everybody was thinking what will be told, how things will be dealt. Will he cover this? Will he cover that? So it was, a complete package. Wonderful. Congratulations. And let me also tell you that a little bit of moderation, whatever I do, I've learned it from Avinash. He's my guru. He doesn't know that. But he's the best moderator I have seen in my life. Crisp, crystal clear. And your presentation today was outstanding. Congratulations.
Thank you.
Thank you, Simi madam, for giving a lot of inputs. Thank you. Thank you to my close friend Amlan. Amlan, please put on your video. If you want to see you. Amlan is my batchmate, close friend, and he was the head of the romantic pack in our batch. He came to the, so we thought
That's why he
but
was
Amlan
grouped.
will know.
That's why he was grouped.
Consensus in our batch that yes, if they talk on romance, love, breakups, Amlan was the best because all our colleagues would go to Amlan for therapy whenever they had a breakup. So Amlan, thank you for coming at such a short notice. Thank you to all our supporters, followers, people who give us all the ideas. A lot of people give us ideas that let us discuss on this, let us discuss on that. And there was a consensus on this, and we actually told Dr. Avinash that you have to talk on this. So he agreed, and he was really wonderful. And Alim has been texting me a lot on my personal chat box that please cool down. You are going overboard. You are being too energetic. You have put on the charger on your body instead of the laptop. It was not that, but I got a lot of questions in my personal chat box. So I was trying to ask those questions, putting my experiences into it. And we see a lot of cases on these things. So thank you, everybody. Thank you, Torrent, for supporting us. Thank you, IPS Odisha State Branch. Thank you once again. It was wonderful having you all. And let me tell you, it was again a record-breaking attendance today. We had more than 380, 390 attendees, more than 450. So there are a lot of people who don't tell, but they might have had heartbreaks in their lives, and they're dealing with it in their own personal way. So thank you so much. Good night.
Alim, you can announce about the next
So please.
program also. It is Freud Revisited in Contemporary Psychiatric Clinics.
So can you be a little more clear, sir? So topic again.
Freud Revisited in 21st Century Psychiatric Clinics.
Okay. Freud Revisited.
Dr.
Dr.
O.P. Singh.
Yeah, OP sir is there.
So good night, everybody. Good night, Simi madam. Good night.
Good night.
Good night.
Amlan.
Thank you, Avinash.
Avinash.